Hello again, everybody. This is Dr. Glenn with Infinite Wellness, here with another one of our question and answer series videos. Happy to have you people listen to this one today. This is an interesting one, little maybe outside of what y'all would think of for chiropractic, but please give it a watch. If you like it, please like it, and even more, keep asking us questions. We'd love to answer them.
So today it says, I've been told I have tennis elbow. Can you help?
Awesome. So yeah, wonderful question, and yes, there are things that can be done for this. Tennis elbow is something we need to really actually discuss to make sure that's what you have. Tennis elbow is a form of tendonitis. Okay, so the term tennis elbow basically was just there because a lot of players who would backhand would often overexert the muscles on top of the arm, in particular where the muscle and the tendon meet the bone. So tendonitis is a fancy term for inflammation of that one spot where a muscle turns into a tendon, becomes fibrous, and connects to a bone. If it is on the outer side of the arm, so in quote-unquote anatomical position, if my hands were rolled outward this way, tendonitis or tennis elbow tendonitis would be here on the top of the arm. It comes from a lot of different things, though. It's not just playing tennis. So obviously that's a cause of it, but not only cause of it. There's lots of different things that can cause tendonitis. And in particular, it's repetitive overuse. Things that we do that overwork that tendon to a point where it becomes inflamed. So inflammation of said tendon is tendonitis. Tendonitis often referred to in this position as tennis elbow. We can also get tendonitis on the lower border of the arm on that ulnar side. That's known as ulnar tendonitis, or often termed golfer's or bowler's elbow. We can get tendonitis in lots of places. The Achilles tendonitis, very common. So it's inflammation of a tendon, and if it's on top of the arm, or even if it's in the bottom where it's golfer's elbow or what they would consider bowler's elbow, that kind of thing, what I'm going to show you is a way to alleviate some of that irritation all by yourself. Give you a few things that you can purchase, and we're going to do that video. I'm going to show you how to actually alleviate this. Now, are there things out there like tennis elbow braces you can buy? Sure. There are things that you can get from your local, like a CVS or a Walgreens. There are things you can order online, but most of them are Velcro. And the reason I'm not a big fan is that Velcro, things that are elastic and Velcro, wear out very quickly. Tennis elbow needs to be braced very, very tightly. You have to be able to take out the component of that tendon that's being overused for a period of time for it to heal up and for the inflammation to go away. Tennis elbow braces can do that, but oftentimes because they're just a wrap with Velcro and just an elastic band, oftentimes you'll find that after a few days of use, especially if you're doing heavy labor, you're out and about, you're sweating in it, things like that, it wears down very quickly and it won't tighten as much as it's supposed to. So I'll show you an alternative to that, which is actually cheaper, and you can repetitively brace that arm lots and lots and lots of different times for a very small amount of money. So tennis elbow, what it really is just inflammation of a tendon on the top of the arm, and it's tendonitis.
When braced properly, how long should it take to start feeling better?
And that's a wonderful question. For time of healing, it can be different for many, many different reasons. So I tell people there's no good, perfect standard. Your age will become a factor. How long you've had tennis elbow will become a factor. If this has been something ongoing, you've had multiple bouts of it, it's been occurring for a year, it's going to take longer to heal. If it's something fairly new and you've only been dealing with it for, less than a few months and just a few weeks, a few days even, it'll heal up pretty quickly. Most of my patients who are under less than about a month of it being around, I tell them 3 to 5 days is about all you're going to need. For something that's been around a lot longer, maybe up to a week to 10 days. Tendonitis can take quite a while to really, really heal up, and it may take as long as about 10 days, but I don't know of much longer than that required. So it is something that can become recurring. It'll occur over and over again if we don't manage it. So I tell people, if it is something that you're worried about, it's been there a while, or it's very severe, you're going to want to do this procedure that I'm going to show you every day for probably 7 to 10 days. And don't miss days with it. Make sure you do it every single day. All right. So the second part of the video, how to address that tendonitis we're talking about. So what I use and how I do this, again, like I said, it's the tendon. If you can see on my arm, I'll try to flex here. It's the tendons that come up the extensors of the arm, and it's usually the pain is all through this region. It gets very inflamed here. So what we want to do for tennis elbow, or like I said, golfer's elbow, which would be right here along this olecranon area, just in the bottom of the elbow, is we want to go distal on the body, closer to the hand, for where we're going to try to support this to take it out of the equation. So what we're going to do is we're actually going to brace here, not where it hurts, below where it hurts, so that we can take this part out. And it's a real simple procedure. I use two things. You can get these from any local Dick's Sporting Goods, Walmart, CVS, Walgreens, anywhere just about. Good old-fashioned 1.5-inch athletic tape and a roll of pre-wrap. This will look bigger. This is almost gone, but pre-wrap is just that soft foamy stuff that goes under tape so that you don't rip all your skin off or rip all the hair off your arm. Not very comfortable if you pull the tape straight off. So that's why we use a roll of each. They're around $4. Probably need a pair of scissors. Most of the time you can tear athletic tape, but every once in a while it won't tear off easy. Just take it and cut it, okay? So the procedure looks a lot like this. I'm going to start out with the nice little foam pre-wrap, and I'm using this just as a little cover, and this is easy, pretty easy to do to yourself. Doesn't take a whole lot. You can kind of support it on a desk, and you're just going to wrap this pre-wrap in a big band around that part of the arm. You don't need a whole bunch of this. It's just enough really to make a coating. And this stuff tears pretty easy. Off she comes. Okay? Then, before we tape this, we're going to use good old-fashioned athletic tape because this stuff's not stretchy. I get asked a lot of times, can I use kinesio tape for this? No. Kinesio tape can be useful and can be used under this. You could put a band that goes down along this way to kind of just lay over the tendon. But to brace the arm, you want something that is not stretchy. Good old-fashioned ankle tape, athletic tape that would brace or lock something up. So then we'll take our athletic tape. Ugh, it's sticky. I promise you'll love this stuff. Okay? And what we're going to do, we're going to take the arm and we're going to make a fist, and then we're going to curl the fist under. So we're flexing the forearm as hard as we can. We want this to be really flexed, like you're picking up a big weight. And then we're going to put our tape on here. Good. And we're going to wrap. And when I say wrap, I mean wrap. Tight enough that it's downright uncomfortable and you're pretty sure you're going to lose blood supply. You're going to go around the arm maybe twice. Oh, I almost got lucky. Not quite. All right, well, if you tear it all up, that's okay. Just cut it off. And then stick it there. And then you can release. When you release, you should feel all of your normal blood flow to your hand. It should not feel tight. But when you flex, it should actually feel very, very tight again and take this tendon out of the equation. If we take this golfer's elbow tendon or this tennis elbow tendon out of the equation when we're lifting, moving, picking things up, etc., then we pretty much have braced or supported it. And if we do this daily on a regular basis, and when I say daily, I mean when you get up in the morning. If you shower, don't do this first, obviously, but if you are done showering or you don't shower in the morning, first thing, put this on as soon as you're done or as soon as you can. Get that on there and leave it on all day long. This stays on all day. We don't take it off unless for some reason it gets soaking wet or it gets frayed or pulled or torn loose, and then you can just redo it. But you want it on all day long. When the day is over, we don't leave this on when we go to bed. We want plenty of blood flow through the arm while we're sleeping because that helps with healing. Plus, hopefully, we're not going to be picking up anything heavy or doing anything repetitive. So before we go to bed, we take a nice little pair of scissors, slide them in underneath here, one little quick cut, and we're done. Really simple. And you can do this every day for several days. Doesn't cost but about $8 to do this. Oh, I don't know, 40, 50, 60 times. So yeah, one single little roll of tape and some pre-wrap will be more than sufficient for you to be able to do that repetitively. And that will make it all heal up, honestly. It seems simple, seems too basic, almost seems too good to be true, but it works very, very well. And if you do it every day, I promise you that tennis elbow or tendonitis of this region and or golfer's elbow, tendonitis of the bottom region, will heal itself all on its own. Little things like anti-inflammatories, if it's really severe at night, like an Advil. We don't always recommend pain meds unless they're absolutely necessary, but if it's that kind of, really extreme pain, you can't sleep with it, we do what we have to do at least till we get it to where it starts to heal up. Hope that helps. Great video for us to be able to teach you a little something that we've learned over the years.